Hi, Pa.
What, you are back?
Thinking about Uncle Shu again?
Yes, he's such a joyous person. But now he's no more around.
Yes, it was such a pity that he lost to colorectal cancer. Oh yes, Pa, why don't you do a preventive screening against colorectal cancer?
Choi, do you think like your Uncle Shu?
No, I don't mean that. I'm just concerned about her health. Anyway, I know someone who is able to explain to you. Let me make an appointment for you.
Mr. Ang Sing?
Yes.
Oh, yes. Hi, please come in. Morning, Mr. Ang. I'm Dr. Wong. So, what can I do for you today?
Dr. Wong, my father's good friend died from colorectal cancer 2 months ago. As they are about the same age, I'm concerned about his health. I've suggested to him to undergo screening, and I was hoping that you were able to convince him.
Wow, Mr. Ang, you really have a very caring son, you know. Now, the guidelines for colorectal cancer screening state that any person above the age of 50 should undergo screening. If you have a relative in the family who is diagnosed with colorectal cancer, the screening should even start younger than the age of 50.
Are there any symptoms we can look out for?
Well, the symptoms of colorectal cancer will include a change in bowel habit, either diarrhea or constipation, or sometimes even diarrhea alternating with constipation that can last for weeks or even months. Other symptoms will include rectal bleeding, abdominal pain, unexplained weight loss, or anemia or low blood count that is picked up on health screening.
But I don't have any symptom and I feel very healthy.
Not quite when we are still having luncheon meat every breakfast. Dr. Wong, how do we reduce the risk of colorectal cancer?
Well, screening will be a very powerful weapon to reduce or prevent colorectal cancer. Now, if you want to reduce your own risk factors, there are certain lifestyle measures that one can adopt. For instance, limiting your intake of processed meat will be a very good start. You should also limit your intake of red meat and also cut down on your intake of meat that's prepared at very high temperatures like barbecued meat, fried meat, and even grilled meat. Other measures that you can adopt will be to cut down on smoking, cut down on excessive intake of alcohol, and last but not least, maintain a healthy weight. Alright, don't put on too much weight. This is a risk factor for getting colorectal cancer. And you should also be physically active. Try and exercise daily because physical inactivity is also a risk factor for getting colorectal cancer.
So Dr. Wong, what are the screening tests available?
Stay tuned for Dr. Wong's response in the next episode. Share this video to those you care and click on the subscribe button to stay updated with more health tips right here.